My name is Ann Albert. I am the Klatt Family Director for Public Programs here at the Herbert T. Katz Center for Advanced Judaic Studies at the University of Pennsylvania. And I am welcoming you all as people are still coming in to this afternoon's talk featuring Professor Natalia Aleksiun speaking about views on women's bodies and public health in Poland. Hi, Natalia, before and after the Holocaust. Natalia Aleksiun is currently the Dalton Rose Fife Family Fellow here at the Cat Center, coming to us all too temporarily from the University of Florida, Gainesville, where she serves as the Harry Rich Professor of Holocaust Studies, teaching and writing about the Holocaust, as well as Eastern Europe and Polish history in general, Jewish childhood, the history of medicine, Jewish historiography, and more. She holds doctoral degrees from Warsaw University, Poland, and NYU. And yes, that's correct. She has two PhDs. She is also the author of Conscious History, Polish Jewish Historians Before the Holocaust, that came out a few years ago from Littman, and a monograph in Polish, whose name I will not try to pronounce in Polish. I'm so sorry. I don't command the Polish language. But the translated title is Where to? The Zionist Movement in Poland, 1944 to 1950. Natalia is also a prolific topical volume editor and co-editor, which is really a service to the field because these volumes are so helpful. So there's one that's a special issue of the journal Pauline called Writing Jewish History in Eastern Europe, a special issue of European Holocaust Studies called Places, Spaces, and Voids in the Holocaust. She also serves as co-editor of the journal East European Jewish Affairs. There's so much more I could say, but right now at the Cat Center, working on a fascinating monograph that she presented to us on the so-called cadaver affair regarding the supplying of bodies to be used as medical cadavers in medical schools between the wars. So that's all I'll say. Natalia, I will turn things over to you. Thank you so much. Please feel welcome.
Thank you so much, and it's a pleasure and honor to be here. I listened to all the previous installment of this series, and I'm truly flattered and already stimulated by fantastic research that was presented. And what I'm sharing with you today is my thinking about the book after the cadaver book. So I have a lot of questions and the material that is starting to fall into place in my thinking about Jewish female bodies, very much alive Jewish female bodies. And something that I thought for this lecture would be interesting to see the degree of continuity and change in the way the community thought of Jewish female bodies before and after the Holocaust. So let me now go to the scary moment for all presenters of finding my PowerPoint and getting us started. And I want to say that there isn't a better place to think together with other scholars about your topic than the Katz Center for Advanced Judaic Studies. And I've been blessed to be part of the cohort this year. So I want to start us with a personal account from a fantastic collection edited by Jeffrey Chandler, Awakening Lives, a collection of autobiographies of Polish Jews written in the 20s and 30s and submitted in several installments to the IVA, Institute for Jewish Research in Vilna. So here is a rather big quote from a young man, as you can see, born in 1911, submitting his autobiography just 5 years before the war. And he talks about difficult childhood, difficult family life. And part of this difficulty and experiences that left a mark on him was the birth of his brother. which he describes in detail. What's very clear is that this birth is taking place at home. There is just a room that is separated. His mother is not at the hospital. And it's traumatic because he witnesses, or rather hears, his mother suffering. There is a midwife there, but not a physician. And in the end, it's a tragic birth as the baby dies, probably crushed by his mother after the birth, or this is the story he's told, but he suspects it might have been intentional, as for his mother, this was a difficult, also psychologically, emotionally difficult pregnancy. So this is very much a different image than picture, quite literally here, a photo from one of the most modest and updated hospitals in interwar Poland, in the Second Polish Republic, the Czyste Jewish Hospital in Warsaw. This is likely not for young mothers. I couldn't find a photo for newly delivered babies pavilion, but you can see how this hospital is presenting itself to the public as clean, orderly, safe, and modern. This hospital was established in 1902, but in 1925, specifically the maternity ward was completely refurbished, expanded, and had something like 150 beds. Now, of course, for a community that was over 200,000, close to 300,000 Jews in Warsaw, that meant that very few women delivered their babies in that nice maternity ward, but it's a vision of how the community was organizing itself, also with the training of midwives, training of nurses, all of this very much devoted, among other Jewish bodies that needed medical intervention, to mothers and their children. And of course, this gendered connection is here in this picture, also from the same booklet that celebrated the success of the hospital. This is a garden that belonged to the hospital, where you can see sick children that were treated in a hospital with their mothers and professional staff, likely in the picture taken in the late 30s. So when I started looking at the kinds of discourses about Jewish female bodies, they were overwhelmingly discourses about Jewish women's bodies as mothers. Mothers already, mothers to be, future mothers, mothers that will bear Polish Jewish children. And this is both on a personal and communal level of discussions. Of course, as these two examples, the autobiography from a town near Kielce and the fancy modern Jewish hospital from Warsaw show, this is very much also a question of how this discourse and the practice surrounding female bodies is divided by class, by age, the generational change, and by geography, not just center and periphery, but especially large cities with Jewish medical institutions and rural areas, and I will come back to it in a moment. This reproductive discourse focuses on new mothers and not just the process of giving birth, but also new mothers are bodies that need to adjust to the needs of childcare and be helped and taught the most proper ways of feeding their children, exposing their children to sun, bathing, playing with their children. All of this is very much in the hands of their mothers, and thus the hygiene as well is also geared, oriented towards motherhood, not just the hygiene of a mother who needs to keep her home clean, who needs to keep the bottles if she's feeding the child from a bottle clean, etc. But it's also the hygiene of a female, Jewish female body that will become a mother at some point. And again, here is a discourse that has many participants, many layers. The most obvious is the medical discourse of medical professionals working at various institutions that Jewish community in the Second Polish Republic between two world wars has created. Research institutions, medical newspapers, etc., but also broader communal discourse of that topic. And I want to start with that picture and introduce to you Dr. Tzemach Shabbat, a distinguished physician working in Vilna, Vilnius today, where a Jewish community constituted over 35% of the population. In 1921, there were some 46,000 Jews living in Vilna, and 10 years later, the number went up to 55,000. Shabbat was involved in activities of the association that took care of medical needs of the Jewish population, specifically in Vilna and in the area. And I put here some of the concerns that very clearly raised to the surface of OZE in Vilna with Shabbat as its leader. So it's the hygienic standards, it's helping children and young mothers, it's preventive medicine, and in terms of helping children, specifically engaging in organizing summer camps for children that otherwise could not experience vacation, could not experience sunshine and relaxation and good nutrition. So just to put it on a map, we are in the Second Polish Republic, which is marked by the yellow line with Vilna here, and then the brown shape is are the borders of Poland after the Second World War. So we will obviously see a dramatic territorial shift, among other dramatic shifts, especially for the Jewish community. So now, keeping in mind the person I've just introduced to you, I want to show you one of his publications in Warsaw Medical Journal. This was not nominally a Jewish journal. It was published in Polish. It was a liberal medical journal with many, many submissions by Jewish physicians that, because they worked in Jewish hospitals and had private practice with many Jewish patients, effectively described the situation, the health situation of the Jewish community in various towns and areas. And so here Shabbat is discussing the reproduction and fertility of Jewish women in the northeastern borderlands of Poland. You saw on a map, it is Vilna and the area, it's the so-called borderlands or Kresy in Polish. And he talks about, this is a long article published in 2 installments, and he talks about his long interest in the topic. In fact, as he says, he started already in 1907 to take notes in the charts of his patients, noting the number of births, noting the number of children that died. So he's been collecting this material, extensive material, for 2 decades already, over 2 decades when this article is penned. And he introduces the topic itself as one of national demographic economic value. Now, it's not necessarily by definition of national value to the Jews, but then he explains that really the vast majority of his patients are Jewish women. And so this is a picture that pertains to fertility of Jewish women in this area. Now, I found it very interesting that he repeatedly talks about our women in this piece. But I think it doesn't really mean our women as in Jewish women, as he's writing for a general interested public of physician and public health activists, but our women are rather here women who were in his practice, of whom he had the knowledge in terms of their fertility patterns. And though there is a little bit of a tension here between his commenting on the one hand of the still high fertility of Jewish women in small town, and there is a tone of satisfaction, possibly even relief, in that note that while the numbers are going down, both in the urban center of Vilna and in a small town, but it's still a rather high number, especially in Stettlech, in small town, of women giving birth to, as you can see, to 7 and more children. And that other comment that I found very interesting was his noting the desire to have children. Now, he is writing on the ending side of Great Depression. Poland is beginning to come out of a Great Depression. So women are still have desire to have children, despite living through very difficult trying economic times. But at the same time, I mentioned the tension. At the same time, Shabbat notes that there are artificial miscarriages. They are problematic because they're dangerous to women. They cause infertility, and that ultimately there is a need of birth control for his patients, for Jewish women in northeastern borderlands of Poland. His interest is not coming out of the blue. This is a bigger story of a state and international interest in tracing fertility and tracing demographic trends. And these are particularly taking interest in issues of reproduction, birth and death of infants, and doing so in Poland in this Institute of Research on Demographic Affairs, created by a demographer, a physician, and a sociologist. these are the questions that they try to find answers to through questionnaire surveys, exactly what Shabbat is doing in his study. So I think there is very clearly a conversation between sort of national Jewish and national understood as a state interest in what is happening with women's bodies in terms of their willingness to give birth and their ability to give birth and take care of newborn children. There is a much bigger conversation happening in Jewish press, especially Jewish press in Yiddish and in Polish that deals with social medicine and public health. And I'm showing you here just two titles by two physicians, one from Grodno and also the borderlands, and one from Warsaw. I do not know. I was looking to identify them. I do not know whether these are male or female physicians. My suspicion is, and this is one of the early conclusions, that this is a discourse about women's bodies, Jewish women's bodies, that is very much happening among men, among physicians and communal activists that are men. But here you have two articles in which we have the same two elements that Shabbat formulated. On the one hand, a concern that there is a decreasing number of births and that the Jews in Poland are behind other religious groups, specifically when compared to Catholics, who are the majority, and to Russian Orthodox. But on the other hand, both physicians, just like Shabbat, conclude that this conscious motherhood, conscious mothering, getting pregnant and having a baby needs to be a concern of the community. And they discuss this issue very much in eugenic terms. Women's bodies cannot bear the number of births that traditionally they would go through. This is an issue not just for individual women and their families, and you saw a snippet of it in this autobiography that I started with, but this is a national problem for the Jews, and that thus there is a need to find a balance between having a new generation, making sure that there is a new generation of Polish Jews born by Polish Jewish women, but also that that they're healthy, that both women and their babies can be healthy. And here is a fascinating leaflet published also in Yiddish, and I wanted to thank my colleague for sharing it with me, Sylwia Kuźma-Markowska, who first pointed my attention to this leaflet. As you can see, published in 1934 in this very mobilizing language of a Jewish woman wake up. And the wake up call is to think about the number of pregnancies a Jewish woman in Poland wants to have. She obviously wants to have babies, but needs to be given choices and opportunities to make to decide about the size of her family. Now, Rubin Raut was a physician that was profoundly involved in the matter, not just as an author of this leaflet, and a few years earlier he published a Polish language leaflet, but also his medical practice, one that continued under a new name after the war. He survived the Holocaust and changed his name and continued working on the questions of women's health. Now, there is a question of social milieus and the reception of the discourse that Jewish physicians and activists might be having on the pages of Jewish medical press. And we don't really know how well, or if at all, the extent to which this discussion reaches beyond urban, often acculturated Polish-Jewish families, because I will show you in a moment, a lot of this discussion is happening in Polish language weeklies. There is the Yiddish stuff, but a lot of it is happening in Polish. And here is just one quote I took from a publication of a non-Jewish physician and actually a professor at the School for Midwives in Krakow. We have heard several wonderful lectures that dealt with Jewish midwives and their role. So here is a Catholic physician teaching future midwives in Krakow, but she is actively involved in working at one of these centers for conscious motherhood, and as such in Krakow, and as such she describes her encounters with Orthodox Jewish women. She's likely exaggerating here that they come to the place only after 10 to 12 births, and she perceives this tension between their sense of religious obligation and their physical exhaustion, physical inability of their bodies to fulfill that ideal. And note here that Ślączkowa is using the concept of a ghetto. It's obviously the ghetto, not in the Nazi meaning of the word. This is the ghetto as in a woman living cut off from the non-Jewish world, entirely surrounded by Jewish institutions and Jewish communal organizations and values. Now, both Rubinaut and the social activists that I showed you before and their journals all are connected to an organization of absolutely crucial role for not just the discourse about the health, but the actual health keeping and providing health services during the interwar years. That is in Polish, Towarzystwo Ochrony Zdrowia Ludności Żydowskiej, or TOZ, Society for Safeguarding the Health of the Jewish Population. Founded in Warsaw in 1921, it brought together earlier initiatives, such as in the case of Shabbat, who was involved in Vilna in such organization, earlier version of it in the Russian Empire. And what's remarkable about TOZ is that, especially as a result of the Great Depression, it was, for the most part, the funding was provided by paid membership. So this was all kinds of initiatives. Here is a lottery that you buy for 1 zloty, and the money goes to the budget of TOZ. And with seemingly limited means, of a large but impoverished Jewish community of 3.5 million people, TOS by 1939 managed to organize 368 clinics and institutes in 72 towns, employing over 1,000 of Jewish physicians and nurses. Now, obviously, not all of this was about Jewish mothers. Not all of this was about maternity wards or care for infants, but this was a very important aspect of TOS activity. And I also would like to shout out to another colleague of mine, Rakefet Zalaszczyk, who has been working on TOS for a while and has written fascinating studies of various aspects of TOS activity. So here, just to give you a kind of material culture of the organization, celebratory issue that celebrated the first 5 years of TOS's activity, and it discusses at length actually the issue of births and fertility and young mothers and children. So this is not just a discussion that is taking place among physicians, but also educational project of reaching out to Jewish women and making them better mothers. And in fact, when we look at TOS's reports, they take great pride in the fact that there is a lower rate of deaths and lower rate of diseases among young Jewish children than among the general population. And they are very happy to take credit for it, for helping mothers to provide that crucial service for the future of the Jewish community. And here you have just one of my favorite posters, and you can also see a snippet of how this is not just a Polish Jewish story. This is obviously a transnational Jewish story, as the poster is printed in Berlin, and the funding comes from the Joint, but it's circulated throughout East, Central, and especially Eastern Europe. And here, I think the image is even more clear, right? We are supporting the new generation of mothers and their children, and we have a particular take on how this should be happening. So this young mother is pushing aside the milk, the cow's milk, and OZE TOS is very much supporting the idea of breastfeeding. I also want to point your attention to the aesthetic aspect of a Jewish female body, that is that this woman has dark hair, right? It's obviously not the blonde model of a Jewish mother that we see in other advertisements in, say, a Polish press. So this new generation of Polish Jews requires good conditions for the mothers, conscious mothers making conscious choices so that their healthy body can carry healthy pregnancies and give birth to healthy children. And then they will be assisted with their newborns in terms of advice about nutrition. There will be advice in kindergartens and schools and summer camps for children. So we have this a hierarchy of Taw's involvement that starts with attention paid to female Jewish bodies that will have that continuity. Now, Taz is also very much involved, and the Jewish public health discourse in general is very much concerned with diseases that are seen as dangerous and for the community that are contracted and that are especially dangerous among the poorer Jews because of living conditions and access to food. Essentially, a lot of the focus is on tuberculosis. So here you have in this Warsaw medical journal, in and of itself, a fantastic source in thinking about all kinds of medical discourses in the 1920s and 1930s. But here, the two topics of concern come together in the study published by Gershon Levin, one of the leaders of TOS in interwar Poland, in Warsaw, practicing in Warsaw, that is pregnancy and tuberculosis. He goes on to discuss his experience with TB patients who became pregnant and how and what a physician can do in this case. So this is no longer prevention. This is when you have a pregnant TB patient, how can you ensure a successful pregnancy? Now, I mentioned that there is a concern about the health of the mother's bodies and then health of the children. So very much concern is materializing through improvement of nutrition and giving mothers nutrition advice. You see, obviously, this is a post photo, right? It conveys a certain story about a woman who brought her toddler, and likely that the child was weighted and measured, and she's being told whether the child is doing well. But if we look at a number of Jewish journals that are devoted to children, not for children, but about children. A lot there is also about what are the best breakfasts, what are the best lunches, what kinds of food should be introduced. But it bounces back and forth, again, also to the body of the mother as advice about nutritious breakfasts is published side by side with admonition that women should not smoke because this will affect negatively their health and by extension their pregnancy and their ability to be healthy mothers. And here again, we have those pieces of the puzzle coming together. On the one hand, training medical personnel that will be overseeing the health of Jewish women, the health of their pregnancies and children, tuberculosis, and measuring the growth of a child. All of this happening in the context of a nursing school in Warsaw, actually very, very famous nursing school. Then the question of the health of the child and the health of the mother somewhat separates in a sense that TOS is very committed to taking children from their homes, especially when these homes are inadequate, dark, without fresh air, basement rooms in which family members might work. And as a lot of the discussion goes, even with the best intentions and with the best knowledge, those mothers cannot provide a healthy environment that would contribute to the health of their children. And so the TOS takes over organizing these summer camps for children, so that children, at least during the summer, they can get better, and this will benefit, again, the future of the nation. So you have here some information about vaccines and food rations and summer camps. All of this is for pregnant women and then new mothers. I mentioned the hygiene that is very much described as a space that a woman is responsible first in her own body, taking care of her own body, but also her surrounding, her home. So you have all kinds of campaigns organized by TOS about keeping the house healthy. And here is Eugenic Classic, a poster about a lecture on syphilis and how syphilis affects. You have in the middle this shape is a wife that is affected by syphilis when she contracts it, and for your children. So you have this man who is responsible for potentially ruining the body of his wife and the bodies of his children. And just to give you a sense of some of the venues where that discussion that I was just giving you a taste of is taking place. These are women's journals about children, public health journals, two prime languages of Polish Jews in Polish and in Yiddish. I mentioned that a lot of the discussion is happening among men. I found a number of interesting female voices. Here is the only female member, Jewish female member of the Polish parliament, Róża Melcerowa, who is publishing in this journal for women, weekly for women, about maternal instinct of Jewish women who, on the one hand, all want a child, but they want one or two, maybe three, but not more. So again, you have this tension between assumed role as future mothers, but also thinking about the healthiest way that Jewish women can be mothers. Outside of the medical discourse, this is also very visible, this assumed connection between female body, Jewish female body, and maternity. Just an example from a rather interesting, short-lived journal, The New Woman. The title kind of tells you all. It's devoted especially to the question of Jewish sports. The main journalist writing for this journal, Mira Jakubowiczova, who was to die in a Warsaw ghetto, I found an account in which she was described as someone who could easily escape because she spoke perfect Polish and had excellent, quote unquote, not Jewish looks, but she stayed. But here she's writing in 1932 about female body in sport. And immediately discussing the connection between pregnancy, motherhood, and exercising, deciding that in the end this is positive, that women, young women, coming of age women, those future mothers, need to be careful how much they exercise, what sports they take on. They should not be competitive too much. because ultimately it's the healthy motherhood which is expected of them, but at the same time they need to and should be healthy, build their musculature and be physically strong. Another venue of these discussions, social medicine, a Yiddish venue. And apropos male voices, you can see how the public discourse is very much happening in the male context. I'm looking at the clock, and I will now just tell you a few words on a post-Holocaust discussion. So after the Holocaust, we have multiple accounts of what I call a communal demographic crisis, a sense that Polish Jewry disappeared, and that in particular, there are no children. Just one of many accounts come from Itzhak Zuckerman, a member of the Jewish Zionist underground in Warsaw. And he goes from this quote describing despair upon liberation, upon realizing the sheer size of destruction. But then he visits a city of Częstochowa, where he hears there is a group of young Jewish survivors who miraculously survived in a labor camp, Hasag there. And the scene is very telling. He enters the room and he sees a group of young Jewish girls, teenagers. And he concludes from this encounter that there is hope, there is future. Why? Because they are future Jewish mothers. There will be Jewish continuity because these young women survived the Holocaust. So the discussion about conscious motherhood, about giving birth to 2 children rather than more children, is obviously completely absent. And the community focuses its very limited resources that will start coming from joint, just like before the war, on helping the few young mothers that it has and helping the mothers with the babies, setting up these clinics, special homes for mother and child, for young child, etc. And the big shift from before the war is the constantly repeated observation that these women need even more education and training and help because they are not surrounded by family members that would help them learn this new role, that they really need to receive all the resources and all the know-how from the Jewish communal organization responsible for the health of the Jewish community, that is TOS, that comes back to be active in 1946. So let me stop here.
Thank you so much, Natalia. And thank you so much to all the people who have submitted questions. I'm going to try to group some a little bit. The first set of questions have to do with this term eugenics. So the questions are having to do with, did it have a good or bad connotation at the time? In what way are you using the term? How did it play out either within the Jewish community or from outside the Jewish community, talking about Jews? So that's a lot, but maybe you just want to talk in a general way to start with about what you're talking about here.
Right.
Was the state of eugenics in the 20s and 30s?
Yeah, this is a great question. And obviously I knew that this is a term that is loaded, but we need to unload it for the conversation that is taking place in 1920s, 1930s, what these Jewish physicians, and they tend to be quite prominent in the Polish medical milieu, not just among, working among Jews, but in general, what they have in mind is healthy nation. And yes, they also use the term race. We need to be, we are minority, we need to be a healthy race. We do not want to produce physically unable to support themselves individuals, but this has nothing to do with interfering with lives that are already there. It's thinking about how the community can promote best possible policies for improvement of Jewish health, collective Jewish health. And yes, the weight of it is very much on the shoulders, as it were, of Jewish women.
Not only on the shoulders.
Yes.
Yeah. I think related is several questions about birth control and also abortion, right? So you mentioned artificial miscarriages and you mentioned birth control. So people are asking what forms of birth control were available. What did women, either more cosmopolitan women in cities or rural women who were more isolated, what did people know? What kind of education happened? And also what forms of artificial miscarriage or abortion were taking place?
So this is a huge discussion in interwar Poland. Again, it's a part of a bigger discussion. In terms of contraception, it's pretty much two things. It's, I think I'm pronouncing it right, it's pessaries, a variety of pessaries. And in the context of Jewish women, TAWS physicians are concerned with, especially with Orthodox women, and what would they, their husband and, what their religious communities would accept. And I haven't found anybody's guess about how far the effect of these reach in the more traditional circles. I think it's also very unlikely, not only because we have the Holocaust, and then vast majority of Polish Jews perish. Certainly the traditional one are affected dramatically. And then before and after, it's unlikely that someone from the more traditional milieu would write about her experiences with contraception. So what we have are these, you use a wonderful word, those cosmopolitan, highly educated, acculturated, often religiously indifferent women. One of the most known is Irena Krzywicka, who actually married a Polish non-Jewish sociologist, who was one of the leaders of the birth control movement. So she writes about it, that she was not interested in being pregnant immediately, but how much does it tell us about Polish Jewish community? I don't think this really takes us far. Now, so I'm still on a level of my trying to figure out the discursive aspect of it, but for the book, I definitely would love to continue digging and see how much, even in terms of family lore, one could get, or stories that physicians share in those medical journals from their medical practice. So I'm hoping I might find not ego documents directly, but intermediary voices. In terms of abortions, there is a huge underground market, and that is exactly the discussion. Women are dying, there needs to be a change, and Jewish physicians, Jewish gynecologists are often implicated in being a lot more involved in carrying out abortions than their non-Jewish counterparts. again, this is certainly a discourse of connecting Jews with aborting children, like aborting pregnancies of Jewish women and non-Jewish women. I definitely see the discourse. I can't really yet comment whether there is any social reality to it. On the other hand, some 40% of physicians were Jewish, and in certain areas, the percentages are even higher. And I think that it's likely that if a Catholic girl wanted to seek abortion, she might go to a Jewish physician rather than someone that she might have social connections or interactions with. But again, something to look at in the future. But thank you. The questions are really wonderful.
Just a quick follow-up on that one is to ask whether in the discourse, whether it seems clear to everyone that for the more traditionally religious, something like birth control or abortion, and I know there are two different categories, would be seen as sinful or contrary to tradition. Or is that something that's a little bit more amorphous, right? Is there a sense that even traditional Judaism would be more open to it than, say, Orthodox Catholicism? Is there a difference there?
Right. So this is something that I've been asking myself. I think that the physicians I've been reading are clearly looking at the at Orthodox Jews as dramatically needing, some upgrade. And I don't see at all any kind of awareness of discussion of nuance between Catholics and Orthodox Jews. My sense is that it might actually be a result of where a lot of physicians are coming from in terms of their social milieu. I'm not surprised that the Catholic activist, the non-Jewish activist writes about a woman from the ghetto subjugated to her husband. But the tone is not that much different in say Rubinaut's leaflets, the Yiddish and the Polish one. So that's a wonderful question and something that I definitely would like to see how it plays out.
Okay, we're past time, but I want to ask one more, if I can hold you for a couple more minutes, which is that we have a couple of questions, of course, about midwives. And here around the Cat Center and in this series, we've had a lot of discussion, a lot of opening up of the question of parallel relationships or competition between midwives and physicians. You've talked, I think, only, if I was listening carefully enough, about physicians.
No, I had a midwife in that opening quote.
Oh, in the opening, right,
Yeah.
right. So where are the midwives? Are they also participating in the same kind of discourse about are they opposed to this new clean public health hospital world?
So I haven't found them speak in those journals. I see physicians, I see activists, I see journalists, I see communal talking heads, but not midwives. And I find it very interesting. Again, I'm only sort of doing my first research and thinking about this book. I see midwives doing midwifery. I see midwives delivering. And there is an interesting, and I was thinking about it in the early modern talks on midwives we have had in the series, that you have this process that we see starting right in early modern period, the male physicians entering and pushing for authority, and so ultimately it seems that the births at home with midwives become the social experience of the poor, of the working class Jews, while Jewish women from upper middle class give birth in those nice Jewish hospitals or in private clinics with beautiful, birthing rooms, etc. So there is a very interesting divide here, but it's a practical divide that I see, social divide, less a discursive one, but it's possible that I'm yet to find a midwife taking a stance on the issue.
Thank you so much. And just eventually you'll be looking at Responsa too, and you might find
Absolutely
a whole nother world of midwives there. We do have to end. I want to thank you again so much, Natalia. This is so rich, and a number of the questions are just thanking you for this beautiful research and for bringing it to us. So you should know that as well. And thank everyone for coming and joining us for this series, thinking about how to find women and in Jewish history and what the sources can tell us. I hope you'll check out the past programs online if you haven't seen them, and join us for future programs. I love to see the names that are repeating in all the questions. So thanks everybody for coming. And I also didn't want to end without thanking my colleagues here at the Katz Center, Diana, Dennis Walters, who's with us, and Brian Lipscomb, who work on coordinating events and on IT, and also Katie Maxwell, who does our beautiful graphics. And finally, my colleagues in Penn's Jewish Studies program, Josh Teplitsky and Simcha Gross, who really helped me conceive of this whole series on women. So I want to give them a little bit of credit too here. So thank you again, Natalia, and thanks everyone.
Thank you so much. Thank you, Anne, and thank you for making it such a welcoming space.